Hello, my name is Boakye Yiadom. Today, I'd like to share the results of a study we did on the use of blood cultures in our facility. Bloodstream infections are common globally, can start as pneumonia or meningitis, and lead to sepsis, which shuts down major organs like the heart, the kidneys, and the brain. In the patient with a bloodstream infection, treatment involves taking samples for blood cultures before starting antibiotics. The results of the tests then help to guide any change in antibiotics if necessary. A lot of patients on admission at the whole teaching hospital have at least one bloodstream infection. However, the problem in a whole teaching hospital is that even though we appropriately start antibiotic treatment for our inpatients, further treatment decisions are not guided by the results of appropriate laboratory tests. So with this background, we set out to see how our hospital managed the processes around testing of bloodstream infections. Our first and most important finding was that doctors are simply not using the blood culture service. Of the 4,278 inpatients we identified who needed them, the test was not requested for 92% of these. Second, blood cultures performed did not impact treatment due to problems at both the clinician and laboratory levels. On the clinician side, there were delayed decisions to request and high sample contamination. At the laboratory level, there were no preliminary reports to inform early changes in antibiotics, and some of the antibiotics tested for the isolated bacteria were also inappropriate. Because of the implications of the low use and the effects of the compounding delays on patients' lives, hospital resources, and antibiotic resistance, we recommend the following 4 strategies towards solving these problems. First, initiate and fund further studies to understand the reasons for low acceptability of blood cultures among doctors, long laboratory turnaround times, and patient outcomes. Second, to establish and enforce a protocol for blood culture and drug susceptibility testing at the whole teaching hospital. Third, to address internal quality control issues with blood culture processing. And finally, to establish and enforce clinical guidelines for the appropriate and rational use of antibiotics for the management of bloodstream infections. Finally, I would like to conclude by thanking the organizations that supported my research. This is my email address if you'd like to find out more about the study. Thank you for your audience.